Welcome to the Forum on Anti-Drug Campaigns, what works and what doesn't work.
Today, our one big fight against this nauseating disregard for human life, we have this platform to start a discourse on the alternatives to the war on drugs.
The problem of illegal drug use is real, complex, and definitely systemic. But most importantly, we want to create a platform for a much-needed, honest, and rational discussion.
When we talk about war on drugs, it's not just about the laws that creating this punitive environment, but the leaders also create this repressive environment as well.
And the focus of many countries' drug policies became on eliminating the supply and the demand for drugs.
The intention of war on drugs is solve the drug problem, but history in many countries shows that it's a war that we cannot and we will never win. Billions of dollars have been wasted for this. Prisons are full of people. It's intended to provide treatment, but it's not providing treatment to people who use drugs. And the head of parliament also said that drugs is one of the evil, the most problematic issues that we face.
According to the Supreme Court, based on its own statistics, there are 128,368 pending drug-related cases being heard nationwide.
Crisis is a terrible thing to waste, and we have the opportunity of converting this crisis, this problem, into innovation.
There is no policy that advocates killing, any individual. So that's not part of our approved policy.
The youth is the center of change in partnership with officials, institutions, and you must recognize the role of the families and their significant others. After studying the effect of shabu on families and children, nasisira ang buhay, nagsira ang utak, ang katawan, at ang pamilya at ang buhay ng tao.
Striving to achieve a drug-free world may sound like a noble and inspiring goal, but it is completely unachievable while being incredibly damaging at the same time.
With our collaborative efforts, parents, family, peers, and community, we hope to achieve and our barangays to be drug-proof.
The UN has said over and over again that the majority of people who use drugs do so with no problem. They don't hurt anyone, they're not even hurting themselves. And only about 11% of people who use drugs might have some problem with it. So when we're developing treatment and rehabilitation approaches, it's really important to bear that in mind. Not to waste the lives, destroy the lives of other people further by forcing them into treatment and rehab. In
Indonesian, there's this phrase, we don't clean the dirty kitchen by burning the house. So what works? Harm reduction. It saves life.
I do not and will never take this campaign against drugs short and easy. We are with the national government all the way in ensuring peace and upholding law and order in our respective communities to protect and keep our families safe.
Work with the police, not against the police. The only enemy is drugs, not each other. We can work together.
Let's explore our options and enrich the discourse on the alternatives we have. Let us adopt the public health lens and consider harm reduction.